everyone, welcome back to Forward Therapy. My name is Kelly Troutman. I am a certified hand therapist. In today's video, we are going through a quick and dirty 5 minutes or less what to do for distal radius fractures, scaphoid fractures. Basically, if you have a broken wrist and you are still in a cast, here are some things that might be good for you to start on. You should always check with your doctor before starting anything. And without further ado, let's get into it. As always, while I am a certified hand therapist, I can't diagnose you via the internet. Please get advice from your doctor. Make sure that this is safe for you to do before you start any exercise program. So there are a few things that you can do while you're in a cast to help promote better healing and help give you a better outcome when you are able to get out of the cast. These are some quick and simple tips, some things that you can start doing while you're in that cast. What are the top 3 things to do while you are in a cast waiting for your fracture to heal? Number 1, you want to manage the pain and inflammation. Number 2, there are some gentle exercises of unaffected joints that you can perform. And number 3, taking care of your cast. How can you help to manage your pain and inflammation? Number 1, elevate that arm as much as you can. Make sure that your hand is above the heart level, and you can do this, at least 10 minutes an hour, but as much as you can, especially the first couple of weeks, is going to be super, super helpful. It also can help to use an ice pack. Because you're in a cast, obviously that you're not going to feel the ice through the cast, so put it at your elbow because that's where a lymphatic center is, so that can help decrease swelling 2 to 3 times a day for 10 to 15 minutes. You can also do some hand pumping exercises. So again, elevating the hand and doing some movement above your head. And then also overusing a sling. So a lot of people are given slings when they first get a cast. If you use that way too much, you're just going to get stiff, your shoulder's going to get really painful, and you're going to have a lot of difficulty later on. So try not to use that sling as much as possible. Some gentle exercises that you can do at the uninvolved or unaffected joints. First of all, the shoulder. Try reaching overhead, to the side, reach behind your back, behind your head. Move every hour with your shoulder so that you don't get stiff. For your elbow, make sure that you're bending and straightening the elbow if the cast doesn't come up over the elbow so that you don't lose mobility and you start getting stiff there. For your finger, you can spread the fingers open and close, and then you can also go through this tendon gliding sequence. And then for your thumb, make sure that you're also exercising that thumb, bending and straightening, touching the fingertips, as many as you can reach. Oftentimes the thumb is a little bit blocked by the cast, but just doing the best that you can, trying to move as much as possible those joints that are out of the cast. And last but not least, taking care of your cast. So you are going to probably be in this cast for anywhere between 3 to 8 weeks. You want to keep it dry and clean. Make sure that you use a plastic bag in the shower so that it doesn't get wet. If it does get wet, you need to contact your doctor so that they can change the cast. Make sure that you're checking your fingertip circulation. Check to see that the fingers are not purple or blue, that you seem to have good circulation in them. Make sure that the cast is not too tight. And also monitor for any tingling or numbness or increasing pain. If you think that the cast is too tight, it probably is. So you want to make sure that you go back to your doctor to see if they can adjust the cast for you. This will help to make sure that you don't end up with other complications like CRPS. So just remember that healing does take time. We want the bone to be nice and strong, so typically that takes about 4 to 6 weeks. Your doctor will let you know based on your x-rays how long you have to wear the cast. So make sure that you're keeping it clean and dry, wear it as long as the doctor instructs you to. Follow any and all instructions and precautions that your doctor gives you regarding use of your arm. Probably you don't want to be using it very much to allow the bone to heal. And ask for help from family, friends, neighbors for any heavy tasks that might be difficult to complete with your cast on. Again, you don't really want to be gripping, lifting, pushing, or pulling while you have that cast on. Okay, that is it. Those are my cast care tips of things that you can start doing to help promote better outcomes and better healing while you are wearing a cast after a broken wrist. Thank you guys so much for watching. I hope this video was helpful. If it was, please subscribe, like the video, or give it a thumbs up, and I'll see you in the next one.